Good afternoon. Thanks for being here. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. We're here to give you a COVID-19 update for Chicago. I'm joined today by David Sanders, the president at Malcolm X College, as well as by Dr. Geraldine Luna, medical director at Chicago Department of Public Health. So as always, we'll start with an update on some data of where we are, run through some information about vaccine operations, and hear about our exciting Vaccine Ambassadors program from Mr. Sanders. We'll hear some remarks in Spanish from Dr. Luna, and then I'll be back to take questions. So we continue to make excellent progress against COVID-19 here in Chicago. We're currently averaging 435 new cases every day in Chicago, still higher than we'd like to be. We'd like to be under 400 new cases per day and ideally under 200 cases per day. But every single day, this number is dropping. It's down 15% from a week ago and heading in the right direction. Our positivity is at 4.1%, the lowest it's been in weeks, also heading in the right direction, and our hospital numbers remain stable. If we look at our COVID case numbers, we see them declining, although I want to be clear, we are still seeing cases and COVID hospitalizations in the last month from every neighborhood in Chicago, so we are not finished with COVID-19. Most of our COVID cases remain in younger adults. We're seeing the highest case rates in people in their 40s, in their 30s, and their 20s. We have higher vaccination rates among people in their 70s and 80s, and that has really helped to keep the case rates down for older Chicagoans. We are also seeing the highest COVID case rates right now in Black Chicagoans, as shown in purple on this graph. We'll post this on our website, chi.gov/COVID- if you want to look at the details. But we're seeing the highest case rates in Black Chicagoans. We're seeing larger decreases in Latinx Chicagoans in blue, in Asian Chicagoans in green, and white Chicagoans in red. And if we look just over the last month by race ethnicity to put some specific numbers on this, so going back to April 12th, just in the last month here in Chicago, we've had 4,766 COVID cases in Black Chicagoans, 3,176 cases in Latinx Chicagoans, 2,239 cases in white Chicagoans, and 461 cases in Asian Chicagoans. So we see, just as we've seen throughout this outbreak, COVID continues to hit the hardest in predominantly Black and predominantly Latinx communities. If we look at where these are showing up in the city, on the left, this is the most recent week. The darkest blue represents where we're seeing the most new cases. So you can see that we're seeing the most new cases right now on the south side, especially the far south side. Whereas on the right side, we see at the high level the percent of population that has at least one dose of vaccine. And again, the darker blue are settings that are more vaccinated, the lighter are settings that are less vaccinated. So increasingly, week after week, we're seeing our COVID cases becoming concentrated in the least vaccinated parts of the city, which is why we're working so hard to make sure we're bringing vaccine, certainly across the city, but with an extra focus on parts of the city that are less vaccinated. Our hospital capacity is not threatened. This on the top is our non-ICU beds. On the bottom is our ICU beds, and our increases in COVID patient occupancy have flattened. And if we look at these severe outcomes, though, here too, we're seeing the effects of vaccination. We have lower vaccination rates overall among Black Chicagoans, especially younger Black Chicagoans, and we are seeing higher hospitalization rates in that group. We're averaging 5 to 6 COVID-19 deaths every day here in Chicago. You can see that's relatively flat, certainly down from the almost 25 per day at our in the second peak and almost 50 a day in the first peak. And again, if we look at the severe outcomes, we are also seeing disproportionately more deaths among both Black and Latinx Chicagoans. Just in the last month, just here in Chicago, 78 deaths from COVID-19 in Black Chicagoans, 40 in Latinx Chicagoans, 31 in white Chicagoans, and 6 in Asian Chicagoans. But really, if you're going to choose one risk factor, age remains the most important one. Oldest people remain at our highest risk for severe outcomes. So again, if we just look at the last month, a lot of people have been telling me, I think we're done with COVID. We don't have to worry about it. That's why we're focused just on the last month. Just here in Chicago, we've had 16 people die of COVID under the age of 40. We've had 68 people die of COVID in their 50s and their 60s. And we've had 76 people die of COVID who who are 70 or older. So critically important that everybody's getting vaccinated, but especially those who are older. And we're keeping a major focus on those over 65, making sure that they are vaccinated. It's the one area that Chicago is still lagging in. We're ahead of all of the other large cities when we look at vaccination coverage overall. We're ahead of all of the other large cities when we look at coverage for Latinx Chicagoans or for Black Chicagoans compared to other cities, but we're still behind for those over 65. And I worry because we're seeing severe outcomes in those folks. Boy, have we done a lot of COVID vaccinating here in Chicago and around the world. We've done more than 2 million COVID vaccines in Chicago, more than 261 million COVID vaccines across the U.S., and more than 1.32 billion COVID vaccines in more than 177 countries. The safety data remains excellent on this. The efficacy data remains excellent. It's just about getting them out and getting the job done. So here in Chicago, 47% of all Chicagoans have received a first dose of vaccine at this point. But we do see some of these same disparities where we look at the race ethnicity breakdown. Above average in terms of vaccination coverage, white Chicagoans, about 53% have gotten a first dose, and about 51% of Asian Chicagoans have gotten a first dose, whereas about 37% of Latinx Chicagoans have gotten a first dose, and 31% of Black Chicagoans. I want to be very clear that we are seeing good increases in all of these groups. And in fact, right now, we're seeing more Latinx Chicagoans getting vaccinated every day than white Chicagoans. We're also seeing good increases among Black Chicagoans, but there is still a long way to go. And I'm especially interested where folks have not gotten vaccinated in some of the communities that are being hardest hit. If we limit it to 18 plus, 58% of all Chicagoans have gotten that first dose, and 68%, if we limit it to those over 65, have gotten a first dose. If we look high level at the population vaccination coverage by zip code, you can see in the lightest blue here, these are the zip codes where more than a quarter to a little more than a third of folks have gotten a first dose. In the middle blue, this is where about 40 to 55% of folks have gotten a first dose, and then in the darkest blue, more than 57%, and even as much as 77% have gotten a first dose. So we still have work to do, but again, some of the areas that are least vaccinated, those 13 zip codes in lightest blue, are where we are putting extra effort to make sure that we can limit any barriers to vaccination. Our equity goals are also certainly at the center of everything that we're doing. As you may recall, we set a goal that the majority of our vaccines every week would go to Black and Latinx Chicagoans. We did meet that goal last week. 56% of our first doses went to Black or Latinx Chicagoans. So got a ways to go, but we're doing well on that front. Huge thanks to all partners and really everybody who's working to make sure all Chicagoans are having good access to vaccine and up-to-date information. We continue to do large numbers at our points of dispensing. At the United Center, we've done more than 251,000 doses in less than 2 months, and actually we're over 260,000 last I looked. And I do want to highlight that there too, we've had a lot of focus on making sure that information is getting out in a lot of languages and to people across the city. So we've done more than 46,000 translation contacts, meaning people whose first language was not English coming to the United Center, doing an initial conversation. Do people need translation? We've got on-site translators, really work to make sure this has been a center accessible for all. And we continue to offer both Pfizer and J&J doses at the United Center. Our strike team work also continues. We've done more than 41 workplace strike teams, especially if we've seen outbreaks or settings that have been harder hit. We've done more than 6,300 vaccinations in these strike teams. We've had 324 senior buildings now with on-site vaccination events. We've been partnering with CHA, with other housing units, really working to bring vaccine to where people are. You all are aware of our vaccination bus. I was out over the weekend, really going very well. We see a lot of people excited about this. You don't get a vaccination while this bus is moving, to be clear. The vaccination bus parks, but then there's some work to go knock on doors in neighborhoods, make sure people are aware. You can see, for example, over the next few days, we're going to be in South Shore, we're going to be in Englewood, we're going to be in Austin. These are dedicated sites like senior centers or libraries. But over the weekend, then we also just were at a park and working with faith organizations, Chicago Police Department outreach folks, and other neighborhood leaders had very good interest, giving out, some small, food, other incentives, brought some music, had a party. We're really pleased about this, and you're going to see the vaccination buses out more. We're also going to be using them with the expansion, the expected expansion of Pfizer to children 12 and up. We'll be using these vaccination buses at some of the high schools, particularly on Saturdays around Chicago, and more to come there. Our Protect Chicago Homebound program has also been very successful. You can see on the left, the dots represent the more than 1,000 places that we have brought vaccine to Chicagoans who are homebound. As a reminder, you can call the number 312-746-4835. No matter who you are, no matter where you are in Chicago, someone will talk to you right away. There's not a big wait. We've got lots of languages available, and help figure out how to get you a vaccine near where you live, or if you have challenges with leaving your home, we will bring it to you. We're in the middle of wrapping up the primary portion of this Chicago Homebound. We've gotten through the whole list of people who had signed up online. Where people are maybe just hearing about this, we'll continue to go out. But what you'll be hearing over these next couple of weeks is we're probably going to expand this even to anybody who's over 65, not even if they're homebound, really looking to get rid of any barriers to vaccine. So you'll be hearing some more about this, but again, we've got a lot of volunteers. We've got Chicago Fire Department, Chicago Department of Public Health, and then additionally other strike teams that have been working to really get vaccine to where people are. And as we think more about bringing vaccine to you, you'll hear more about further expansion of these in-home options. We'll be rolling out some more work with food pantries and parks and transit stops, some more with churches and local settings. And there will be more opportunities for community organized events where a group is pulling together a number of people who want a vaccine. We'll work to bring that vaccine to whatever setting is needed. So we do expect probably the ACIP for the CDC, we expect will probably give the go-ahead for children 12 to 15 to be able to receive the Pfizer vaccine, and we are ready to start vaccinating on Thursday. There are appointments available now, ZocDoc.com/vaccine, or through our call center, 312-746-4835. We had to do a little bit of reconfiguring this morning to make sure the site knew that even if you're not eligible now, you can make that appointment for Thursday. I would encourage people to make an appointment. We will keep walk-in options. So all City of Chicago points of dispensing across the whole city, as long as we're dispensing Pfizer, which we are at all of our sites, will be open to 12 plus. But make that appointment if you can. It helps make sure you won't have to wait. We'll have enough vaccine on hand. Pharmacies are also all of the chain pharmacies and nearly all of the independent pharmacies have said from Thursday on they will also take children 12 and up for Pfizer. We'll have a list available on our website of which pharmacies those are. And we're working with a lot of pediatricians' offices, with some of the children's hospitals, to really make sure vaccine is available through providers. So in case anybody's not heard the word, the news for the Pfizer vaccine for children looks really good. The safety profile was great. The efficacy profile, meaning how protective the COVID vaccine was really, really good. In the part of the study with the volunteers, there were actually no cases of COVID in the children who got the vaccine and no serious side effects. So really looking good as far as this vaccine being important for adolescents. And I encourage all Chicagoans to really make sure you're getting your kids vaccinated. You do right now at the beginning need to be there in person, a parent or a guardian with any child 12 and up. And again, only the Pfizer vaccine is the one that we expect to be authorized. And finally, I'm about to turn it over to David Sanders, the president at Malcolm X College, to talk about an initiative we're really excited about, the Vaccine Ambassadors Initiative. I do a lot of talking every day about this vaccine, its safety, its efficacy. I'm a doctor, so last night when I was in clinic, I was answering lots of questions about vaccine. I'm a vaccine ambassador everywhere I go. But our goal is to turn anyone in Chicago who wants to become a vaccine ambassador, we want to give some support in terms of doing that. And we've partnered, as you'll hear, with a number of folks here, really starting off with City College of Chicago in terms of doing this in a way that's organized and that will really bring the right information to Chicagoans. So with that, I'm pleased to turn it over to David Sanders, the president at Malcolm X College.
Thank you, Dr. Arwady. It's certainly an honor to be here today. And I certainly want to thank you for the leadership that you've shown in leading us during this pandemic. So I'm pleased today to kick off our Vaccine Ambassador course in support of our community. We are inviting the public to become volunteer vaccine ambassadors with a free online education course offered by Malcolm X College. It only takes 2 hours to complete, but it will pay it forward in empowering our community to keep healthy. Registration is open right now. Before I go further, I certainly want to thank the mayor and her leadership. The city did reach out to us and ask us to partner with this, and it's a part of what we have done in the past. We were instrumental in the contact tracing program, so I certainly want to thank them for the trust and the confidence they have in us. Certainly Dr. Arwady and the Chicago Department of Public Health, my staff, and City Colleges of Chicago, Partners in Health, Rush University Medical Center, and Chicago Cook Workforce Partnership were all involved in the development of this program. Why are we doing it? There's so much information out there about COVID-19 vaccines, and we thought it imperative to help people separate fact from fiction. We're launching the Vaccine Ambassador course to educate people and to address the mistrust and the vaccine hesitancy that exists in many areas today. People are more likely to listen to their friends and neighbors, and that is why we developed this local ambassador program and why it is so important. And as we think about the social determinants of health, part of what we do is ensuring that we are developing practitioners in their community so that they can go back and talk to their friends and relatives about the healthcare system. And we've seen that that has been very successful in getting people to have more trust and confidence in the healthcare system. So we're following that same pattern. City Colleges is providing vaccine ambassadors with vaccine education that they can share the facts and save lives. Ambassadors will educate and ease concerns. In the course, students will learn the background on COVID-19 in the United States, the history of mistrust and the root causes of vaccine hesitancy, answers to their most frequently asked COVID-19 vaccine questions, and then how to approach difficult vaccine conversations. And we're seeing that happen in homes today where the parents are divided. One is saying, I want it, and one is saying not. There's concerns about the children. So we want to have these conversations. Chicago community members who complete this course will receive a certificate of completion and be recognized as trusted messengers of COVID-19 vaccine education. Upon completion, Partners in Health Vaccine Course Partnership will provide these trusted messengers access to our online learning community, where they will have opportunity to connect with our vaccine ambassadors and receive support through additional training, stay involved in community health activities, and help the community move forward towards vaccination. Special thank you we want to give to Rush University Medical Center and their CHW Hub. They were very instrumental in helping us. And again, the Chicago Cook County Workforce Partnership and their contact tracing core. And at this time, we'll take any questions that you may have.
Sí, muy buenas tardes. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago, y ahora voy a hacer unos apuntes en español, solo para que nuestra audiencia en español, nuestros latinos, hispanos, tengan conocimiento de lo que está ocurriendo en nuestra ciudad. La ciudad de Chicago anunció hoy que todos los sitios de vacunación operados por la ciudad que ofrecen la vacuna Pfizer estarán abiertos para jóvenes de 12 años en adelante, a partir del jueves 13 de mayo. Ayer, la Administración de Drogas y Alimentos de los Estados Unidos otorgó la autorización para el uso de emergencia para este grupo de edad y espera que los Centros de Control y Prevención de Enfermedades, o también conocido como el CDC, otorguen la aprobación completa, o mejor dicho, las recomendaciones completas para el miércoles. Al igual que todos los adultos, animamos a los jóvenes de 12 años en adelante que se vacunen. Los datos actuales muestran que la vacuna es segura y eficaz en niños. Y solo protege a nuestros niños, sino que también protege a las familias y a nuestras comunidades. Acuérdense que la seropositividad en niños es la más alta en este momento. Vacunando a nuestros niños bajamos la propagación del virus, bajando la carga viral del virus en nuestras comunidades. En Chicago, las comunidades de las tasas de vacunación más bajas continúan teniendo el número más alto de casos y tasas de hospitalización y muerte, incluso en adolescentes y adultos jóvenes. Ayúdenos a aumentar la adopción de vacunas y superar el COVID-19 reuniendo a toda la familia para que se vacunen. Así que la finalidad de nuestro mensaje es que todas las familias se vacunen ahora que estamos hablando de nuestros niños. Las citas para el jueves en los centros de vacunación administrados por la ciudad se pueden reservar ahora a través del centro de llamadas de la ciudad. Por favor, tomen nota. El número es el 312-746-4835. Repito, 312-746-4835. Y para aquellos que tengan la habilidad de ir a su computador, pueden hacer citas. No es requerida, pero para su conveniencia, para que puedan recibir la vacuna sin esperar, puede hacer su cita en el socdoc.com/vaccine. Y allí en menos de un minuto puede conseguir su cita. Siempre tienen que tener presente un padre o tutor debe acompañar a cualquier menor de 18 años y se alentará a los padres y tutores no vacunados que reciban la vacunación en ese momento también. No será necesaria cita previa como ya les mencioné, aunque se recomienda por la conveniencia. Ahora también les quiero hablar de la iniciativa que tenemos para los embajadores de la vacuna con Malcolm X College. Es un curso que tienen ahora gratuito en línea para cualquier ciudadano de Chicago, ofrecido a través del Departamento de Educación Continua de Malcolm X. Tarda 2 horas en completarse, se ofrece en inglés y en español. Y para obtener cualquier información o más información y registrarse, por favor diríjase al embajador de la vacuna cc.edu en las líneas de Malcolm X. La inscripción comienza hoy. Los estudiantes podrán comenzar a tomar el curso mañana mismo. Cuando se trata de discusiones sobre COVID-19 y vacuna, los habitantes de Chicago confían en quienes conocen más de cualquier celebridad, autoridad fuera de la ciudad. Así que tenemos que tener en cuenta que nuestros jóvenes se estimulan y reciben toda esa información de las figuras públicas en el momento para que apelan a su edad. Existe mucha información errónea sobre las vacunas y el COVID. Hay personas que son reacias a vacunarse y solo quieren que sus preguntas sean respondidas, preferiblemente por alguien que conozcan y que confíen. ¿Qué mejor manera de adiestrar a nuestros jóvenes y a nuestras personas aquí en Chicago para que sean embajadores de la vacuna? Empezar una cultura positiva alrededor de la vacuna para que cada quien se sienta cómodo a la hora de sentarse a tomar su vacuna del COVID-19. Este programa tiene que ver con la equidad. Hacer llegar la información a todas las comunidades por todos los grupos etarios para que se puedan sentir conectados. Contrarrestar las dudas y la información errónea con hechos, pero abordar las preocupaciones genuinas de las personas, con respecto y consideración a las razones por las que algunas personas dudan de recibir la vacuna o simplemente se oponen. Los embajadores son vitales a todas las edades, que dan a conocer los hechos de su comunidad, dan testimonio de cómo la vacuna les ha afectado positivamente la vida y que cada uno de los 77 vecindarios de la ciudad tenga las herramientas y el conocimiento que sean necesarios para combatir el COVID-19. Los estudiantes en curso aprenderán antecedentes sobre el COVID-19 y el sistema de salud de los Estados Unidos, historial de desconfianza y causas fundamentales de esas dudas de las vacunas de acuerdo a nuestras comunidades, de color, y las que no son de color. Respuesta a las preguntas más frecuentes sobre la vacuna del COVID-19 y cómo abordar conversaciones difíciles sobre la vacuna. Capacitación y apoyo adicionales disponibles para los embajadores estarán también disponibles a la finalización del curso, ofrecido por Partners in Health. Esperamos que toda esta información ayude a combatir la resistencia que tenemos contra las vacunas del COVID-19. Y en una nota positiva, ya hemos vacunado más de 2 millones de personas. Si hablamos de 18 años en adelante, ya andamos vacunados 56%. 48% de nuestras personas aquí en Chicago han recibido las vacunas en forma completa, las 2 dosis, o si usaron Johnson & Johnson recibieron su única dosis. Pero cuando lo dividimos por grupos étnicos o grupos raciales, 51% de nuestros caucásicos 53 se han vacunado, 51 de nuestros asiáticos, pero para latinos solamente el 37% y 31% de nuestros afroamericanos. Tenemos una amplia preocupación de que los repuntes del COVID-19, los brotes, ocurran otra vez en esos vecindarios que no tienen buena cubierta de vacunación. Así que anímase y vacúnese. Hay mucho ocurriendo.
Thank you, Mr. Sanders and Dr. Luna. Just one note on the vaccine ambassadors. You'll be able to get to it off the, obviously, City of Chicago COVID site, but if you want to get there directly, you can go to www.ccc.edu for City Colleges of Chicago /vaccine ambassador, and that will take you directly to the program. Happy to take questions.
Dr. Arwady, Mariano Gillis for Univision Chicago. Historically, every time the city opens a new phase of vaccination and adds a new group, it's always the white residents and the more affluent residents who have access first to said vaccine. What is the city doing to avoid this from happening now that 12 to 15-year-olds are going to be able to get vaccinated?
Yeah, so access, just to be clear, access opens broadly, as you know. It's not that it opens by race, ethnicity, or by affluence, but we regularly see people who have more resources able to perhaps prioritize vaccination more easily. So most of the work that we are doing related to bringing vaccine into communities is predominantly in under-vaccinated communities. I do want to say, again, for folks who are over 65, we feel critical about making sure that gets across the whole city, but especially where we're thinking about children. There's been a lot of extra work where we're working with CPS, for example, who will be a major partner for us. And a lot of that initial work will be in heavily Black and Latinx communities. And the good thing is we have enough vaccine. And so there is plenty of vaccine for any Chicagoan who is wanting it, and especially for any Chicagoan over 12. But some of the work, like the Vaccine Ambassadors Program, is to make sure we're doing everything we can to try to bring lots of voices into this conversation. And we continue to work also for providers in under-vaccinated neighborhoods. Have been critical in terms of partnering and bringing folks in, and we're doing the same thing for pediatricians.
Can you walk us through what a parent can expect on Thursday in terms of what they need to bring, what they need to sign?
Yeah, sure. So broadly speaking, this is the Pfizer vaccine, meaning that it is a 2-dose vaccine, just for starters. So you would get the first dose as early as Thursday, and then you would need to bring the child back 3 weeks later for the second dose. You will come to any of the sites, whether it's one of the large sites, whether it's the drive-through site at the United Center, whether you're walking into your pharmacy, whether you're going to your pediatrician, you'll need to go with your child, so a parent or guardian, and you'll need to sign agreement, basically, that you are approving of your child getting the vaccine. Then other than that, you'll be with the child through the process if there's a need to move, and the same nurses broadly and others who have been vaccinating would do the vaccination. We're making a special effort to make sure, to talk to the children directly and see if they have any questions in advance, but you would move, and in fact we're encouraging people to bring whole families in terms of getting folks vaccinated, and then your child would get the same vaccine card that an adult would receive receive, and we collect the same very limited information that is only available to public health about the child, the date of birth, the address, and the type of vaccine that they've received.
And do you anticipate children being required to get the vaccine for school in Chicago later this year?
So at this point, of course, our focus is just on getting started and making sure that vaccine is very widely available. Right now, the vaccine remains under emergency use authorization, and we're just now starting in terms of being able to vaccinate a lot of children, which I'm excited about. There are certainly conversations that are happening across the country. As you know, there's a history of having childhood vaccinations broadly required for school, although there are exemptions that come along with that. I think the COVID-19 vaccine is going to be part of that same conversation. Certainly right at this moment, there is no requirement for vaccine for a return to school, but I strongly encourage all parents to really get their kids vaccinated. Even before we're talking about school, where we think about kids gathering this summer, we're bringing back a lot of the things that people are excited about this summer. You know, the pools are going to be open, the camps and the parks and the beaches, children are going to be gathering, and this is by far the safest way to help protect your kid and your family more broadly. So that's where we are right now on that.
This question is for either Dr. Arwady or for David Sanders. How will you be able to gauge how many people are signing up for this course, and how hopeful are you that a lot of people will actually seek it out?
Yeah, so this goes through our continuing education program, so we're able to track the individuals that are coming through that. We already know that we have about 650 people who are in our contact tracing core that are going to sign up for this program and add that on, you know, as an additional tool set that they will have that'll make them available. But we believe that there's about another 10,000 people that are ready to take this course. So we're going to be tracking that. The thing to know that this is a free course. It's free of charge. So, you know, those are estimates. It could blow up much larger than that, and we would love that, because the whole goal of this is to ensure that we're getting the information out, that you're able to have the conversations and an educated conversation that's going to help you to really look at the vaccines and see that there is a tremendous benefit to you and your families.
All right, thanks everybody.